it's a health fair, and so there's different like organizations out, and La Clinica and everybody, and they're just educating the youth. So I think it's cool.
This event is our first annual Block Party for Health. The whole 10th Street community, all of the OUSD entities, Met West High School, Dewey Academy, La Escuelita K-8, and the United Nations CDC, and La Clinica Youth Heart Health Center to come together and serve our youth and just to keep our youth safe and healthy.
We are the first school-based health center in the area to open a vision center. A lot of times vision issues go unnoticed, or they can be misdiagnosed for something else going on. And so we really want to make sure that every student has the opportunity to have academic success, and that's linked to them being able to get the services that they need. And so vision is now something that we can promote and that we can bring kids in for, so we're super excited.
Today was amazing. There was a lot of students here, people eager to get knowledge. We actually had a table for Mentoring to Medicine and Science where students were able to get their blood pressure taken, which we know a lot of people don't even have health insurance. So just to have that opportunity to understand like how their health is from that standpoint, people were pretty amazed to get those numbers and have that experience.
Mentoring Medicine and Science is an organization itself in Oakland, and we're a nonprofit pre-health organization. So basically our biggest mission is to train individuals who are young individuals who are interested in the field of health or are underrepresented in that field. So one of the programs is the Healthy Ambassador program. So these two are actually current college students who are part of the Healthy Ambassador program, and they get training on different health issues happening in their community. Then they go to different schools within Oakland to teach those topics.
I think it's extremely important. A lot of times you can find out a lot about a person just by looking at what their blood pressure is and checking other vitals as well. So I think that's like key. If you start there and you see like either it's too high or too low, then they know some things that they need to change, and if they need to like actually consult with the physician.
Education is so important, you know, so it's our job to really educate them on how to stay healthy and how they can be healthy. Not even just as a response to when they're sick, but really a lot of preventive care.
And we're trying to really promote a fit lifestyle, but also really thinking about eating more whole foods. You know, we could have easily had a barbecue pit out here and some burgers, but I mean, we want to do something different. We want to go back to our roots and really try to do things that are going to promote, you know, a healthy lifestyle, right? And so that's what we're trying to do.
Yeah, I think it's cool because a lot of the times we're not like taught a lot of stuff in classes all the time, and if it is, it's really biased. So I feel like here we get to like talk to people, ask questions, you get to like get papers, and then if you don't read it here, you get the papers to learn more about it later, and I think it's just nice. It's like communal.
I had a good time at the one where you made the smoothies, just to be able to get on the bike and have the fitness, and also learning about different nutritional groups and the importance of fruits and vegetables in your diet.
I learned more about HIV and just about safe sex in general, which is cool. I had to take sex ed class, but it was really just showing pictures of like horrible like sexually transmitted diseases or illnesses, and then like abstinence afterwards. So like this is cool because then they just talk about like if you're gonna have sex, then you know this is the right way to do it and stuff like that.
You know, we just want to increase access. We want to break down barriers for families, especially for our low-income folks and low-income families, especially for our people in Oakland. We're trying to break down those barriers to receiving healthcare, to being healthy people and leading healthy lives. So it's so important to not have to charge for any of our services. We just want to break down all those barriers and keep our community safe.